Welcome to a nursing care plan presentation for the medication Prochloperazine. We will be presenting this information in an S-bar format, including situation, background, assessment, and recommendations. There will be instructional videos in between to demonstrate these steps in a real-life patient-to-nurse interaction. First, let's go over our situation. Annette Vargas is a 25-year-old female who was diagnosed with cervical cancer after a routine pap smear. PET scan confirmed inguinal and pelvic node involvement. After undergoing a radical hysterectomy and lymph node dissection, Ms. Vargas experienced post-operative emesis. She was given promethazine intravenously. She has undergone 2 of 6 cycles of chemotherapy. She has been prescribed an antiemetic regimen, but her chemotherapy-induced nausea remains poorly controlled. The patient continues to have multiple episodes of severe nausea and vomiting that last for up to 1 week post-chemotherapy treatment. She wants to continue with the treatment but complains that the nausea and vomiting are unbearable.
Knock knock! Hi, I'm just going to wash my hands really quick and then we'll get started. Let me check your wristband. My name's Emily and I'm a nurse here to see what's going on with you today. What brings you in?
Well, I've had a lot of nausea and vomiting and on round 2 out of 6 of my chemotherapy and nothing seems to be working and it's been pretty bad.
Okay.
And now for the background of the patient. The patient is alert and oriented to person, place, and time. The patient is cooperative, conversant, and able to swallow. Her skin is warm and dry. Patient is slightly pale. Extremities are warm, and patient is not on oxygen.
Hi, Ms. Vargas. Can you tell me a little bit about the background of your situation and why you're experiencing so much nausea and vomiting?
Yeah, well, I was diagnosed with cervical cancer about 2 months ago.
Okay.
I've been doing chemo on my 2nd round out of 6.
Okay.
And I don't know, it's just been uncontrolled recently.
Okay. Are you taking your nausea medications that you're prescribed now?
Yeah, but it doesn't really seem to do much. I don't
Okay.
really feel it making an effect at all.
Okay. And then I see that you had surgery to take out the cancer. Did you have a lot of nausea and vomiting with that surgery also?
Not particularly. I mean, I was kind of out of it for a day after,
Okay.
so I don't really remember. But
Oh, okay. All right. All right. Well, let's take your vitals and we'll ask a little bit more questions and then we'll see what we can figure out for you.
Okay.
During the assessment, it's important to ask the patient a few questions. Ask patient to verbalize nausea and vomiting severity using a scale of 1 to 5, 5 being severe and 1 being no nausea and vomiting. Examine the patient's abdomen for bowel sounds, distension, tenderness, or masses. Also, review client's blood test results for complete blood count, electrolytes, urea, creatinine, LFTs, serum calcium, magnesium, and phosphate if appropriate. Evaluate and document nausea and vomiting history, including onset, duration, timing, frequency, and aggravating factors.
All right. Well, let's get your vitals taken and we'll see. I'll ask you a few questions and we'll see if we can figure out something that might help you with this nausea and vomiting.
Okay.
Okay. Can you take some deep breaths for me? I'm gonna just listen to your stomach too. Yeah, nice active bowel sounds there. Okay, let's take your blood pressure. Okay. How are you feeling right now?
There's some discomfort.
Okay. All right, 98.6, no fever. Okay, so, can you describe the pain for me, or the nausea and vomiting?
Well, it's pretty much just like burning. I just feel like I always, now my throat is burning. I
Okay.
keep vomiting and.
Okay. When are you feeling this nausea and vomiting?
Usually a little after my therapy.
Okay, and like maybe 2 or 3 days or a week or
Oh, it's constant.
constant? Okay, and how many times a day do you think you're vomiting?
I lost count. I mean, it's pretty regular. I can't
Okay.
really keep food down.
Yeah, okay. You're not able to keep anything down.
Not really, no.
Do you have any aggravating or alleviating? Does anything help it feel better or make it worse?
Not that I can think of. Nothing's really worked
Okay.
yet.
And it looks like you have a regimen of anti-nausea medicines right now. Are you taking those regularly?
Yeah, but it doesn't really do much.
It's not helping.
No,
Okay.
no.
Okay. And the timing is just all day long. Is there anything else about it that you think I should know?
Well, I mean, I felt pretty dizzy. I mean, I don't really keep anything down.
Okay.
So I'm
Okay.
kind of lightheaded.
How about when you're standing up? Like, do you have,
Oh, I usually have
Dizziness
someone
mornings?
with me. I get pretty dizzy.
okay. Are you walking much or are you mostly in a wheelchair?
A little bit. I mean, I have a physical therapist come in and walk with me, or family members will walk with me.
Oh,
But
good. Okay.
usually I'm just too exhausted.
Okay.
Now for recommendations. Let's start with the treatment. The nurse will administer 5 to 10 milligrams of Prochloperazine 3 to 4 hours as per orders. Some non-medication treatment options include acupressure, ginger ingestion, distraction, music therapy, or guided imagery. Now for education. Inform the patient of possible extrapyramidal symptoms and tardive dyskinesia symptoms and to report them immediately. These include dystonia, pseudoparkinsonism, akinesia, akathisia, or neuroleptic malignant syndrome when taking this medication. Inform the patient to notify the physician right away if they feel like they have a sore throat, fever, unusual bruises or bleeding, weakness, rashes, dark urine, clay-colored stools, or visual disturbances develop suddenly.
Hi, Annette. I talked to your doctor, and after some careful consideration, he's decided that Prochloperazine, or Compro, is going to be a good medication to help with your chemotherapy-induced nausea.
Okay.
Here's a pamphlet about it, and let's just go over a few side effects and important information about the drug.
Okay.
Okay, do you know anything about Compro?
No, I've never heard of it.
You never heard of it? Okay. Well, it's used for dizziness, anxiety, some mental illnesses, and a few other things, but for you, it's going to help with your chemo-induced nausea.
Okay.
Let's see what else we need to talk about. Before we actually start taking this medication, it's important that we know if you've had any of these conditions or taken any of these medications. Okay, so before you start taking this medication, let's just go over a few conditions that might be contraindicated with this medicine. Have you ever had any liver or kidney problems?
No, but there's a history of like alcoholism in my family. But
Okay.
I don't personally drink.
You don't drink. Okay, well, that's good. That was actually one of my next questions. Have you ever had epilepsy,
No.
hypothyroidism?
No.
How about heart conditions?
No.
Okay, we're probably going to want to test you for hypokalemia and hypocalcemia, which
Okay,
is,
why is that?
they are low calcium and potassium, and they just are contraindicated. This drug could make them lowered.
Okay.
So we want to test that before you get started, and we'll just keep an eye on it closely as you're using this medication therapeutically. And then also, if you start taking any of these medications, we'll have to make adjustments. And those are painkillers, strong painkillers,
Okay.
antacids, anti-diabetics, antihypertensives, or amphetamines. Okay, so if you just see in your pamphlet here, if you need to remember any of those things,
Okay.
they're all in there.
Okay.
So you don't have to try to memorize it all now. Okay, so to take this medication, you'll take 5 to 10 milligrams 3 to 4 times a day as needed for your nausea and vomiting. You don't want to abruptly stop taking this medication because there's some withdrawal effects like rebound nausea, which is the nausea coming back really strongly and severe, sweating, involuntary movements, and inability to sleep. So if the medication's not working for you, just give us a call and we will talk to the doctor and we'll wean you off of it slowly so that you don't have those sudden side effects. You'll want to keep this medication away from children because it is not safe for children.
I don't have kids.
Okay, good. Keep it in a cool, dry place. Don't use the medication if it's expired. And just dispose of it as your pharmacist tells you. Don't just throw it down the drain. You can
Okay.
take it to the pharmacist or the healthcare provider and they'll help you dispose of it properly. Do you have any questions about it so far?
Well, I was just wondering why, how it's like an antipsychotic or and also for nausea.
How does it work for both things?
Yeah.
Well, it blocks 2 neurotransmitters and the action of both of these neurotransmitters, and one of them is dopamine, which controls motivation and cognition and regulation of emotional responses. And the second neurotransmitter that it blocks the action of is acetylcholine, which is released by muscles in order to activate the muscles to work. So by blocking it, it stops involuntary movements, and in your case, it numbs the area of the brain that causes chemotherapy-induced nausea and vomiting. So both of these neurotransmitters are responsible for controlling nausea and vomiting, but because it's such a strong and effective drug, it does have some stronger side effects. And some of them are really important that you notify us right away if you have any of these symptoms. So the first one is called neuroleptic malignant syndrome, and the signs of that are fever, respiratory distress, which is, like having a hard time breathing, tachycardia, really fast heart rate, seizures, hypertension, which is high blood pressure, and loss of bladder control. I know it sounds really intense, but it'll really help the nausea and vomiting.
Okay.
So just make sure if you do have those side effects, you call right away, because that is
Okay.
an emergency situation. The other one is called extrapyramidal side effects, and that's going to be blurred vision, dry eyes, which you can just use eye drops if you have that, constipation, dry mouth, and then also with that one you could have the possibility of the fast heart rate and hypotension, so it's a low blood pressure. And then with the dry mouth, you can just use sugarless candy or take small sips of water. A lot of people with chemo like to suck on candy because it helps with the nausea too. So, yeah. Did you have any other questions?
Do I?
I don't know. You can always give us a call if you're wondering anything, and then you do have your pamphlet that will answer a lot of questions, and I'm here for you anytime if you have any problems. And definitely make sure you are familiar with those side effects and that you call right away or have your family members. You can even teach them about some of those side effects and have them help you keep an eye out for them.
Okay.
All right. Well, I really hope this medication ends up working for you.
I do too.
We want to get you feeling a little better as you finish up your chemo.
Yeah, I would like that. It's been really difficult.
For this patient, our nursing diagnosis would be nausea and vomiting related to effects of chemotherapy treatment, as evidenced by reports of nausea, food aversion, gagging sensation, vomiting, and sour taste in mouth. Our outcomes: number 1, the patient will be able to verbalize how to take antiemetic medications before and after chemotherapy treatment. Number 2, the patient will report relief of nausea symptoms within 6 hours. Thank you for watching our video on Prochloperazine. Please stay tuned for our reference page all the way at the end.